everyone, Professor Davis here, and we are going to dive into the integumentary system here in medical terminology. So again, let's take a closer look at the function of the integumentary system first. And so when we look at the function of skin, guys, it does a lot more than what you would normally think of. A lot of times we look at the fact that it's a barrier between the inside of us and the outside of us. And that is true. It's actually going to be the first line of defense of your immune system. But your skin also does a lot of other things for you. For one, it helps you produce vitamin D. Okay, this has to be in conjunction with sunlight, which we don't get as much of as we used to because we also use sunscreen, SPF. This blocks it and it blocks the production of vitamin D, but your skin could do this. Another one is that it eliminates waste through perspiration. So sweating allows some waste products to leave. And guys, we're using derma here as our kind of scenario to help us remember what they do. So D is vitamin D, E is eliminates waste. R is it regulates your temperature of your body. If you didn't have skin, you would have a really hard time regulating your body temperatures. We then have M. M makes information about the environment available to your brain. You have tons of receptors in your skin. They have receptors for cold, hot, pain, pressure, vibration, touch, different types of touch like tickle, itch, light touch. We have lots of different receptors located here. And then A, it acts as a barrier to disease-causing organisms. So again, first line of defense, it's that barrier, that fence that helps protect you. So let's look some of the anatomy and the anatomy words that deal with the skin. And so when we look here at the skin, you could use cutaneo, dermo, dermato, they all mean skin. Okay, they all have that. So when we talk about cutaneous membrane, it's talking about your dry skin. Dermo or dermatologist, you're talking about somebody who deals with the skin. All right, and so that's where those words come from. We see that your actual skin is going to be divided into two main sections. The top is the epidermis. Okay, when we were kids, you'd hear kids say, "Oh, your epidermis is showing," and you're like, "Oh, stop, whatever." It's you're saying your skin. Your skin is showing. The layer below that is the dermis. Okay, so the dermis is going to be the deeper and larger layer of the skin. Now, under the dermis, there's what we call the subcutaneous layer. This layer is made out of fat. And so adipo or lipo are going to deal with fat. So adipose tissue is the fat tissue. We also have keratinocytes who are going to be responsible for that epidermis layer in the skin. They get their name because they create keratin, which is a protein that helps give kind of a cornea or horny type of structure on the skin, which makes it that barrier. Okay, it makes it have that strength and be able to offer you that protection. And then again, if we use derm at the end, this is skin or germ layer. Now, if you'll notice here in this picture of the skin, we've got lots of stuff going on here. We have different types of glands. There are sweat glands that are located and they go out to the pores straight onto the surface. We also see that there are glands that connect to the hair follicle. These are going to be sebaceous or oil glands. There are even smooth muscles in here, but the pilomotor muscle is going to help with moving the hair follicle. You see the hair follicles themselves, as well as blood vessels and different types of nerves that are present in the skin layers. So then we have hydro, and this is going to deal with sweat. Onycho is nail, as well as ungul is going to be also nail. Pilo or tricho are going to be for hair, and sebo is going to be for sebum. And so we've got lots of different things here based on these accessory glands, whether it's sweat glands, whether it's your nail, your hair, or even oil that we see present. So these are going to be for those accessory skin type words that we see throughout this chapter. All right, so again, some other terminology we see here is the dermis or corneum, epidermis, and ectoderm. These are all the layers we're talking about on that outer part of the skin, and it is going to be all created by that ectoderm layer, the outermost. We have keratin or keratinogenesis, so this is the beginning of that epidermis layer. And then you also have the subcutaneous or adipose layer at the bottom. So again, if we look at this picture here with the skin, you have the epidermis, you have the dermis, and then you have the subcutaneous tissue with the fat. Also here, guys, accessory structures not only found just your skin as part of this system. We have hair, nails, sebaceous glands, and sweat glands. So accessory skin structures are structures that are embedded within the dermis. You're familiar with the fact that you have hair and nails, but did you know that they are derived from the same embryonic layer as your skin? And so they're all part of that ectoderm layer. Sebaceous glands secrete an oily substance that we call sebum. It's kind of like your natural lotion kind of structure for your skin. It keeps your hair and skin soft and pliable and inhibits the growth of bacteria. Sweat glands are also called sudoriferous glands. When stimulated by increased temperature or emotional stress, these glands produce perspiration that evaporates from the skin, giving a cooling type of effect. These glands do not create a sweat, though, that stinks. That is the interaction between your sweat and bacteria on your skin, which gives you that odor smell. We also can look at this cross-section of the skin and identify, again, a lot of these skin structures. So we do see that you have the sweat glands that are present. You can see that they can connect to the hair follicle, or they can just go straight up to the pore in the skin. We do see that they eliminate some waste, and they also help you regulate your body temperatures by cooling you off. The two types of sweat glands you see here are the apocrine. These guys are going to be the ones associated with the hair follicles, and they do interact with bacteria on the skin, giving you an odor. And so these are going to be located a lot of times where there's extra hair that's present, like in the axillary regions under your arm and the growing regions. The eccrine are going to be the ones that open directly onto the surface through the pores of your skin. These get stimulated by temperature increases or emotional stress, and they do release their liquid, the fluid, perspiration. You'll also notice that there is going to be a muscle that is attached to the hair follicle. This is known as the arrector pili, or the piliomotor muscle. And this helps the hair stand on end. So when you get that feeling where the hair stands up on the back of your neck, or you get that, what we call chicken skin or goosebumps that happens on your skin, it's this muscle that helps do that. Fingernails and toenails are also here. These are modifications of those horny epidermal cells with the keratin. These nails are thin and pliable. They're dead epidermis type of cells that are present, just like the top layer of your skin is also dead. We do see that there's a number of different parts. The nail matrix does have the part of the cells that are still alive and dividing. They are going to be connected to that nail root. The nail bed is going to be where there is a blood supply, and it helps hold the nail body to your finger. And then the free edge is the part that comes off of the actual finger area. All right, so accessory skin terminology are going to deal things with like the arrector pili muscle, sebum or sebaceous, sudoriferous. Axilla or axillary is talking about the armpit area. Onychophagous is somebody who habitually bites their nails. Okay, so if you're constantly biting your nails, you would be considered an onychophagist. Onychophagia is the actual act of biting of the nails. Ungula is another word that's used to pertaining to the nail. And the lunula is the area on the nail that's going to have like a half moon by your cuticle we talk about, that's lighter than the rest of the nail bed. That's the area that's talked about there. So these are all terms that are going to deal with the hair, skin, and your glands. All right, so let's talk about some biopsies and laboratory tests that are done with the skin or integumentary system. Each of these biopsies involves examination of the living tissue. And so we do see that they are what we consider taking some of that tissue and then looking at it further to see what's going on. So we have an incisional biopsy, is cutting of a wedge of tissue from a lesion, followed by a suturing or closing up the site. So you take it out and then you sew it up. An excisional biopsy is one in which the entire tumor is removed along with its borders. And again, this is a way to look for making sure we have clean margins. And you'll hear about this sometimes when people go for skin cancer and they just kept they say, oh yeah, they just kept taking it out until they got clean margins. This means that they got all the area around, hopefully getting all of the cancer. Another one is a punch biopsy. This is an insertion of a tubular punch through the skin to the subcutaneous tissue to extract core tissue for examination. We also have a shaved specimen sample, which is performed on superficial lesions. They use a razor blade to obtain the specimen. We also see that they can get material by doing a curettage, which is the scraping of material from a lesion using an instrument that's called a curette. They can also do a fine needle aspiration biopsy. This is going to be where they use fluid from the lesion for culture, and they can examine using a thin needle in order to see if there's bacteria present, viruses, fungus, that kind of stuff. We also see that there's some other tests we could do, which is a patch test. This determines allergens. So if you've ever had an allergy test, you've probably had a patch test to see what you're allergic to. Tissue or fluid obtained by a needle aspiration can be examined microscopically. Bacterial and fungal cultures can be done in an effort to grow causative organisms in an artificial culture medium to see if infection is present. And so these would be, of course, normally taken through a fine needle aspiration, but then they are grown on a culture to see what's going on. Some fungi are fluorescent when viewed with a wood lamp or ultraviolet light, like a black light, and so these are another type of way to test to see if a fungus is present. The light causes hairs infected with certain microorganisms to become fluorescent, so even on the skin they could look at this. We also see another laboratory test that's used for the integumentary system is the sweat test. This is done to test for abnormally high levels of sodium and chloride that can be characterized specifically with patients who have cystic fibrosis. Individuals who have cystic fibrosis have a very high level of sodium chloride, which means that they have very salty sweat. And so this is again a laboratory test for something like that. The next one we're looking at are pathology word parts that can be used in this particular chapter. So you have chiro, which is cold, erythromato, which is erythra or redness that takes place, folliculo, which is a follicle, helio, which is heat, ichthyo, which is fish, necro, which is dead or death, ritido, which is wrinkle, septo, this is infection. We also have aero, which is dry, and phoresis, which is transmission. So these are some of the pathology word parts that could be used here in the integumentary system. All right, so let's talk about some of the pathologies that are present here. You can have partial or total absence of pigment in the skin, hair, and eyes, and this is known as albinism. So albinism means that you don't have any kind of pigment in your skin, hair, or eyes. We also see that you can have cyanosis. Cyanosis is a lack of oxygen, and so the skin starts to turn blue. The mucous membranes in the skin start to turn blue, and this is normally going to be associated with severe heart or lung disease because you're not delivering the oxygen through the blood like you should. And so a lot of times you'll see a bluing in around their mouth, their nose, or their fingertips and their toes. Ichthosis is any of the several skin conditions in which the skin becomes very dry and scaly. So it resembles like fish skin. So that's where the name comes from, ichthosis. Jaundice is another one where the skin gives away something is going on deeper in the body where it starts to turn yellow. So the skin, the mucous membranes, the sclera, the whites of the eye turn yellow. And this is usually due to bile pigment being in the blood. And so the liver is not processing it like it should. This could be due to excessive rupturing of red blood cells that can occur, kind of like a hemolysis. It could also be due to the liver failing on its own, like a cirrhosis of the liver, or it could be a blockage of this bile being sent to the actual intestines that we see with the gallbladder. So it could be obstructive. So there's a lot of things that could be taking place there with jaundice, but the liver is normally the culprit. Xerosis is an excessive dryness of the skin. It's caused to be, it causes you to want to scratch. And so because of this, you see that it's scaling, thinning, and injury that can occur in the skin because of you wanting to scratch that surface. All right, and this can take place with abnormal dryness in your eyes, your skin, or even your mouth. This brings us to skin lesions. There's lots of different lesions, and a lesion is any visible, localized abnormality of the skin. A primary skin lesions are the ones that are initially going to occur due to like trauma or disease. And a secondary lesion are those that are evolved from their primary form. Okay, so they change or there's something different about them. All right, so primary examples are located here. We see that an abscess is one, and it's a pus-containing cavity that is surrounded by inflamed tissue, and it's usually caused by infection, specifically Staphylococcus. It's normally going to be the bacteria that causes this. Healing usually occurs when the abscess drains or is incised, so you cut it and you drain it. Staphylococci often is abbreviated as a staph infection, and these guys are going to produce pus. That's the kind of bacteria they are. Ebola, which are blisters greater than 1 centimeter and filled with normally clear fluid. Cysts and nodules cause raised areas of overlying skin. A cyst is a sac filled with fluid or a semi-solid type of material, whereas a nodule is a marble-like solid lesion more than 1 centimeter wide and deep. So you'll notice a lot of times the size of these determines what kind of category they fall into. Plaques are kind of elevated patches more than 1 centimeter in diameter. We then have vesicles are blisters less than 1 centimeter, and they're also filled with clear fluid. Urticaria is an allergic skin eruption that's characterized by transient elevated irregular shaped lesions, and a lot of times we call these wheals. Treatments include antihistamines and removal of the stimulus of the allergen a lot of times to get rid of this. And another name we use for urticaria is hives. Now, if a skin lesion again evolves, it becomes a secondary type of skin lesion, and these are going to be some examples of secondary lesions. So atrophy is one, and this is where the skin becomes atrophied. It's characterized as being paper thin or wasted away. A loss of skin markings as well. Excoriation is going to be a scratch or an injury to the surface of the body, and this is normally due to trauma. We then have fissures. Fissures are crack-like lesions in the skin. Scales are dried fragments of sloughed epidermis. Frequently you see scales in an individual who has psoriasis. We also have different types of scars. A scar is a mark remaining after the healing of a wound, and there's different ways that this can happen. All right, some scars are going to be where they're a lighter color or a darker color. Some are going to be raised, and if they're raised and they start to actually kind of almost grow due to that scarring and that scar tissue, we call this a keloid. We then have an ulcer. An ulcer is a crater-like lesion, and a lot of times these are going to be found in the skin or mucous membranes where pressure has been placed, and you hear us a lot of times older people will have pressure ulcers due to what we also call bed sores. And those are going to be in areas where bone and skin are kind of in between a harder surface, and it causes them to cause a crater-like lesion. All right, so let's talk about dermatitis and skin infections real quick. We do see dermatomycosis. This is a superficial fungal infection. This is going to be, most fungal infections are superficial. They're found in the skin. They don't go real deep, but we do see that this could be things like ringworm or tinea. It's a group of types of fungal infections that all kind of work together. And it gets its name not because it's a worm, it is a fungus, but it kind of makes a circular shape which looks like a worm on the skin. We have then a furnicle. Furnicles are commonly called a boil, and it's a localized type of infection that begins with an infection a lot of times of a hair follicle or a sebaceous gland. And again, most of the time the culprit is Staphylococcus. We then have herpes simplex virus type 1 or HSV1. This is going to cause classic fever blisters. These fever blisters are also known as cold sores because they often follow a cold or a fever because your immune system is normally fighting something else, and so these guys will emerge as a secondary type infection. Scabies. Scabies is a contagious dermatitis caused by an itch mite. So these little bitty mites, little bugs, it's transmitted by close contact. And a lot of times these guys are known as bed bugs too. We then have a verruca. A verruca is a benign warty skin lesion, also known as a wart, with a rough surface. It's caused by a common contagious virus. Okay, and so we do see that it is going to be one of those viral infections. And guys, one thing to note, remember viral infections, a lot of times once you have them, you always have them. So if you've got herpes or you have verruca or warts, it's going to be something that might come and go. It sits latent and then it will come and reemerge at different times. All right, so let's talk about some other skin abnormalities that can be referred to here. We have actinic keratosis, and this is a pre-malignant lesion that is common in people with chronically sun-damaged skin. These pre-malignant lesions may progress to skin cancer if the lesions are not removed. And they're usually treated because this type of keratosis can progress to squamous cell carcinoma, which is a type of skin cancer. The next one is Kaposi sarcoma. It's the most common malignancy associated with AIDS. This is the lesion that is going to be small, purplish brown papulas that spread throughout the skin, the lymph nodes, and the internal organs. Other disorders associated with lesions include diabetes and malignant lymphomas. Okay, so these are going to be normally seen a lot of times as a byproduct a more severe illness like AIDS or a lymphoma. We then have a lipoma. This is going to use the confining form of lipo, which means fat. A lipoma is a common benign tumor consisting of mature fat cells that usually can be removed easily by excision. And so if you watch Dr. Pimple Popper on a regular basis, she actually removes lipomas all the time. Okay, and so it's going to be one of the things that she looks at. We then have malignant melanomas. Malignant melanomas are often shortened to just melanoma. It is a pigmented neoplasm or cancer that originates in the skin, and it's due to the melanocytes, thus its name. Those melanocytes have become cancerous. Now, this type of cancer, melanomas, they are highly metastatic. It's one of the most malignant of all skin cancers, and it causes a high mortality rate in affected individuals. Because about half of the malignant melanomas arise from moles, it's really important for you to check your moles out. Look at the edges. Look at if they become irregular. Do they become more raised? Does the color change? All of those things could be indications that they are evolving and changing into a malignant melanoma. And so you need to check those out. Another term for a mole is called a nevus. Okay, so a nevus is a mole. This is going to be plural as nevi. Another word here is petechiae. Petechiae are tiny purple or red spots appearing on the skin as a result of really tiny hemorrhages within the dermal and submucosal layers. And so a lot of times we would say it's kind of like a rash that occurs. But these are these tiny petechiae, tiny hemorrhages that take place. All right, let's talk about some injuries that can happen to the skin. Now, if a skin is scraped or rubbed away by friction, it's known as an abrasion. Okay, so we're talking about like an abrasion would be like a carpet burn. Okay, we can also have a contusion, which is going to be where we have damage to underlying areas, and you'll see like a bruise that happens because of that. Decubitus ulcers are going to be a special type of ulcer due to people who are immobile or limited mobility. These are also known as bed sores. Okay, and so these are going to be sores that occur as a result of mechanical trauma or lack of adequate blood flow or circulation to that area. And it's normally due to pressure. Okay, so a lot of times they're known as pressure ulcers as well. And so when the person is laying on their side and they have their hip bone and then a little bit of skin and then the bed, it's putting pressure on that skin and it causes it to potentially break down. Okay, and so that is causing some issues there when we talk about ulcers. A keloid, when we're looking at a keloid, is an excessive overgrowth of unsightly scar tissue. And so this occurs in some individuals as they heal. So everybody scars differently, and keloids are going to be an overgrowth of scar tissue. A laceration is a torn or jagged wound that takes place. And then a puncture is a wound made by piercing. Okay, so you pierce through the skin and that would be considered a puncture. So these are all types of injuries. Now, one injury to the skin that's not talked about on here is burns, which gets its own slide. Okay, because burns are a really big deal because we have different types of burns. So burns are tissue injuries resulting from excessive exposure to heat, electricity, chemicals, radiation, or gases. These can all cause a type of burn on your skin. Now, when this happens, we do see that there is going to be a different magnitude of the injury based on a couple of things. How deep did the burn tissue or the damaged tissue go? What's the extent of the total body surface area? This is known as the TBSA that was burned. Burn tissue usually represents various levels of damage. And so you can end up having what we call a partial thickness burn. And so partial thickness burn could be superficial, where it's just very basic, like a sunburn, okay? Or it could be a deep partial thickness that goes further down into the layers of the dermis, which can still be a sunburn, but those are sunburns that have the actual blisters that come along with it because it's a deeper burn. However, you can also have full thickness burns, and that means we go through the whole layers of the skin, and a lot of times those have to be treated with skin grafts, right? Another thing we look at is that TBSA, and we can do it quickly by looking at the different parts of the body. A lot of times they use the rules of 9. All right, so if you'll notice, these are kind of broken down into 9s. 4.5 and 4.5 equals 9. And so you have the head is 9, whether it's the front and the back, it's half of that. Same thing with your right arm and your left arm. Your front side of your chest is 8, of your body is the chest, and the abdomen is 18. Your back is 18. Each leg, front and back, is going to be 9 each. So this is that rule of 9s that can be used for the TBSA. It gives you a quick way to kind of look at it. Now guys, burn depth, burn severity takes into consideration the factors such as size, location of the burn, mechanism of the burn, duration and intensity of the burn, and the age and health of the individual. So the very young and old are the most at risk because their skin is not going to be able to withstand this change as much. Serious burn injuries can result in systemic disturbances, including fluid shifts that take place because you start to lose fluid. Have you ever even just done a carpet burn where the topmost layer of your skin came off and it kind of weeped, where liquid, it was kind of like a yellowish crusty liquid that starts to happen, comes out? Guys, that is a fluid shift. And when it's large amounts of the body that has lost the skin, this can actually cause dehydration and death in the patient. Also, when we remove the skin layers, we are making us prone to infection. Microorganisms have a better chance of getting in and causing infections. Now remember, burns can be classified as 1st degree, 2nd degree, and 3rd degree, and even 4th degree if we get all the way down into the bone and muscle. So today, the American Burn Association, or ABA, characterizes burn injuries according to the depth of tissue destruction. So superficial or deep partial thickness and full thickness burns are going to be what we see here. So superficial would be more of your 1st degree. Deep partial thickness would be your 2nd degree, and full thickness burns would be looking at your 3rd and 4th degree, depending on how far it goes down. All right, so let's talk a little bit about some accessory skin disorders. And so this is going to deal more with hair and nails and that sort of thing, and sweat glands. And so you have alopecia. Alopecia is a baldness. Alopecia is a premature baldness that occurs earlier in life. Diaphoresis, it means excessive sweating. So you recall the suffix phoresis means transmission. And we see that the dia means the transmission through. And so this is going to be excessive sweating. Infections of intact skin that involves the hair follicle is going to be folliculitis. This is when bacteria enters in and accumulates and grows, causing it to be kind of like an ingrown or infected hair follicle. So this is known as folliculitis. Hidradenitis is inflammation of a sweat gland, and this could be a chronic form of hidradenitis is caused by a closure of the pores with secondary bacterial infections, specifically of the apocrine sweat glands. This can happen in the armpit area or in the kind of genital area. It is characterized by a tender red abscess that enlarges and usually breaks through the skin to form a cyst. So this is going to be where it goes a step further with the idea of forming a cyst. Onychomycosis is a condition of the nails resulting in a fungus. This is really kind of gross. You've seen probably commercials where they talk about the fungal cream for like the toes, and it shows the little guy that the fungus looks like a little monster who like lifts up the toenail, which that's the part that's the worst because your toenails aren't supposed to do that, and scratches underneath. It makes the nail very thick and yellowed in its structure, and that's due to a fungal infection. All right, so let's talk a little bit about skin grafts. I probably should have had this on the slide before when we're talking about the idea of 4th degree burns, 3rd degree burns. where skin has been removed and now we need to replace it because we got down to that lower level. So a skin graft is a transplantation of skin, and it's to cover an area where skin has been lost through a burn or other trauma. So it's not just burns that cause this, but any kind of trauma where the skin has been removed. If the graft is from the patient's own body, it's known as an autograft because you're taking it literally from one place on yourself to somewhere else. So there's no chance of rejection because it's your own skin. An allograft is a graft of tissue between two genetically different individuals of the same species. And so we're using, again, human transplantation of the skin, but it's from somebody else. A skin flap is a special type of skin graft which involves moving a section of skin to a nearby area without cutting off the end of the transplanted tissue. This is done to leave some of the blood circulation intact. We also have in here talking about dermatomes. Dermatomes is an instrument used to cut thin slices of skin for grafting. Okay, so that's the instrument used for that. Histocompatibility is super important and necessary for successful transplants to take place of any organ, tissue, or skin. And the reason is we have to make sure they match. You hear about how when they find a transplant and they're like, oh, you're a match. They're looking at the histocompatibility. The reason being, guys, is if the graft or the organ is incompatible, your immune system will attack it and remove it. And then you're worse off than you were before. And so we've got to make sure that it's a close enough match to where your immune system can't tell the difference. That's the point. And we want it to be close enough. All right, the next one we want to talk about are the surgical and therapeutic interventions. So we've got several types here. The first one is chirosurgery. This one is where warts need to be destroyed by chirotherapy. It's a technique of exposing the tissue to extreme cold to produce well-defined areas of cell destruction and get rid of those cells who are growing abnormally with the virus. We then have debridement. Debridement is the removal of foreign material and from dead and damaged tissues as well from a wound. When we do debridement, we have to go in and dissect away different parts in order to see when we get to good tissue, because you only want to be removing the dead and the stuff that should not belong in the wound. Escharotomy is a surgical incision into necrotic tissue from like a severe burn, and it's done to relieve pressure from severe swelling. And so a lot of times they'll kind of cut that open in order to allow for pressure to be released. Most surgery is tissue sparing and is often used on the face. So thin layers of malignant tissue are removed. Each slice is examined microscopically for the margins to see until you find clear margins. This way we're not cutting out huge areas of the skin. Onocectomy is going to be used when we're talking about removal of a nail. And so we're going to get and take a nail off, and this could be due to trauma, it could be due to infection, where the nail needs to be removed. On the other hand, we do have plastic surgery examples that are present here when we're talking about the skin. This is a replacement or restoration of body parts performed to correct a surgical or cosmetic defect. And so you do see we can have collagen injections. This is a reconstructive technique. It's used to inject collagen to enhance the lips or plump up sagging parts of the facial skin. Electrolysis is sometimes used to destroy the hair follicles when hair is growing in an undesirable place. So we do see that you can use electrolysis to destroy that area and to hopefully where the hair won't grow back. Lobectomy is a means of removal of fat from the abdomen, neck, legs, arm, belly, or elsewhere. They place a narrow tube under the skin and apply a vacuum and suck out the extra fats, and we call this liposuction when we do this, and we're removing parts of that. Rhinoplasties, which are facelifts. Rhinoplasty means surgical repair of wrinkles, and so you are pulling the skin back, you're bringing it tighter to get rid of those wrinkles. So these are all examples of different types of plastic surgery options with the skin. All right, so this brings us to drugs, to the pharmaceuticals. So we do see drug delivery could be topical or transdermal when it comes to the skin. Topical medications or drugs placed directly on the skin, like a type of lotion or cream. Transdermal drugs, though, are delivering through the skin by like a patch. Sometimes a skin patch, like for hormones we might use, certain medications, or even like Nicoderm patches, the same kind of thing. We do have some examples here. So you have anti-infectives, which are topical. They inhibit the growth or kill microorganisms on the skin. Anti-inflammatories are topical. They reduce inflammation. Anti-psoriatics are going to be used to treat psoriasis. Keratolytics induce shedding of the top layer of the skin to help treat acne or removal of warts, corns, or other types of lesions. Retinoids, you've probably heard of this one before, regulate epithelial cell growth to treat acne, psoriasis, and other skin problems as well. Scabicides or pediculicides kill scabies, lice, or mites, and so they're going to be used a lot of times to help take care of lice infections, bed bug infections, things like that. All right, last but not least, we have our abbreviations. And so we do see we have BX. BX stands for biopsy. DLE, which is discoid lupus erythematosus. We have staph, which is going to be short for staphylococcus. TBSA, which is total body surface area that we saw for the burns. TENS, which is going to be transcutaneous electrical nerve stimulation. We call these a TENS unit. They use electricity to go through the skin to help treat muscles. And then you have UNG, which is going to be an ointment. All right, and again, these are not all of them, but these are just some to help you review different parts of the integumentary system. So again, make sure you're going through your book, and if you have any questions, please let me know.